Hey guys, welcome to Medicare GPS, navigating you step by step through your Medicare journey. My name is Paula White.
And I'm Jamin White. We're founders of Four Oaks Medicare Planning. So, what do we have on topic today, Paula?
Yes, so today we're going to be talking a very timely topic of why are Medicare supplement premiums skyrocketing?
Yeah, we're getting a lot of people calling in, visiting their mailbox, and getting some unexpected and unfriendly rate increase mailers. So, I think this is a timely topic.
Yes. Before we get started, though, guys, remember to like and subscribe our channel so it helps other people find us easier. So let's jump on in. So, Jamin, how do we know the difference between a Medigap plan and some other type of plan? How do we know this, who this applies to?
Yeah, so generally, remember, the Medigap plans are the ones that you're paying a premium for, and you're on original Medicare A and B. So you're paying for a Medigap plan to cover those other costs that you're responsible for under original Medicare, like the 20% under Part B or that Part A deductible. So you're going anywhere Medicare is accepted because you're on original Medicare. And then those Medigap plans come in and just pay those other coinsurance amounts or deductibles depending upon which Medigap plan that you have.
Right. And so that's where you hear the Plan G, the Plan N are the most kind of popular ones.
Yeah, it's the alphabet soup. These are the standardized plans that the government allows the insurance companies to offer. So, right, we have the Plan F, the Plan G, the Plan N, the high deductible Plan G. There's a menu of options, and depending upon which one you're on is going to dictate, what your monthly premium is and what the rate increases are doing on those particular plans as well.
So why are these premiums going up so much here in 2025?
Yeah, so we know that the economy, there's a lot of different factors that are hitting the market right now, and the insurance companies are having to adapt to it. There's different reasons why Medigap plan increases happen. These are regulated products, remember. So these Medigap companies, these insurance companies have to go to the State Department of Insurance to get these rate increases, and they have to justify them. They can't just come in and say, give me a 20% rate increase. The insurance departments are going to want to know why. And they're getting the why. And some of the factors that we're seeing are, number one, inflation. The price of eggs, the price of bread has gone higher. Well, there's a lag effect in the insurance market. Remember, it's easy to change a price of eggs, but in order for the insurance company to justify a price increase, they have to see those claims come in. So after the last year or two, they're seeing those increases through medical inflation come in, but also just utilization as well. More people are going to the doctor. More people are going in for those surgeries. Remember, COVID is a little bit of a distant memory, but a lot of people didn't go in for those elective surgeries and they were scared to go into the hospital. Well, people are not as scared anymore. So the utilization of Medicare is going up. The more people that utilize Medicare, they're utilizing their Medigap plans more. So while during the COVID area, we didn't see as great of increases because the utilization tended to be down, now the utilization is up. And so that's a second factor that's happening in addition to inflation. And then the third factor is medical costs for procedures and things like that. New technologies, new medicines are hitting the market as well. So there's another factor of just those procedures that are more cutting edge that Medicare is now allowing to come onto the market and pay for. Well, that's hitting the Medigap plans as well. So we kind of have a perfect storm where these insurance companies were seeing double-digit rate increases across the spectrum.
That's great. What are they supposed to do? Maybe they got a small increase last year. Now they're getting these double digit increases in some cases this year. What are people's options?
Sure. We just sent all of our clients kind of a, hey, what do we do now when we see some of the rate increases happening. There's kind of four things that you can consider. Number one, you just absorb it. You like your coverage. It's going higher. You don't like it, but everything else is, but you want to stay put. That's a absolutely fine way to do it. We take things year to year as we see it. So that's number one. Number two, we can shop your Medigap plan. And what I mean by shop in this option is we can look at a different company, but keep the same type of Medicare plan. So meaning like if you have a plan G, we can shop another company's plan G and we can see if we can get a lower premium for the same coverage. Now, when we do shop that, unless you have a specific circumstance, you're going to be subject to that medical underwriting, the health questions. So it's not a guarantee that you'd be able to get it, but it's worth a shot. And we're happy, obviously, to look at that. So number three is we can kind of look at downgrading the Medigap. So like, for example, if you have a plan G, you can go to potentially a plan N where you have a little bit more of out-of-pocket costs when you go in to the doctor or go in for something. But because of that, you can get a lower premium. So downgrading your Medigap plan might be something to help you stabilize those premiums and start at a lower cost. Number four is kind of the Medicare Advantage, the Part C option. Sometimes people just cannot absorb any more of these increases in costs, right? And so we can look at the Medicare Advantage Part C market. Though it's not our first option, it is a way that we can still help get a budget-friendly result and still give an out-of-pocket max. But again, all of these just depend upon your circumstance, but that's kind of what we're advising our clients to think about as we're looking at the unfortunate rate increases that are hitting the mailbox now.
Well, and I think that's the biggest key is people needing to understand the Medicare, the medical underwriting, right? It's not just like, oh, I just want to go get a new quote, like auto insurance or something. You have to, in circumstances, go through this medical underwriting.
And it's not a huge process. I mean, you're not having to take blood tests or anything like that. They're just going to look at your medical history. And remember, you don't have to be in perfect health. They're not looking for the marathon runner that has nothing going wrong and 10% body fat and all of that type of stuff. You can have some medical things going on. Just think of major organ systems and chronic conditions. Those are the things that they're going to want to look at a little bit. But that's why we're here, right? We know the different questions that the companies offer. So we can kind of do a quick analysis to say, hey, I think we might be able to have some success in this company. Or, yeah, I'm not sure. I don't think we're at a time period that we can do anything, but that is always something we can look on a year-to-year basis, because it might be that we're within a time period that we need to wait another year before after
maybe
a certain treatment, and we might be able to get in at that point. But it's just always worth a call to see if we can help alleviate some of the strain on the budget.
Yeah. So for more information on this, I got 2 blogs for you guys to check out. One is basically this topic. We've just written an article for it and published it this week called Medicare Supplement Premiums Increasing by Double Digits in 2025. And it kind of outlines what we've talked about here today. What are those main reasons for those increases? And then also, what can you do about it, right? The second one is just for folks that maybe are like, I don't get all of these letters and maybe I have a G, but I don't know what he means by downgrading to an N, for example. We also have a great blog on the website called Choosing Your Ideal Medigap Plan. And that kind of goes through those different options. So also a really, really great resource on our website, go4oaks.com.
Absolutely.
All right. So now it's time to move on to story time. What do you have for us today?
Well, we've been talking a lot about those that are on the Medigap plans. And so I didn't want to leave out. I have a really great story of someone who has a Medicare Advantage plan. You get more out-of-pocket expenses under an Advantage plan, sometimes in hospital copays and even some co-insurance, like with a cancer diagnosis. We just had one client that we had put on a hospital indemnity type of option with like a cancer rider. It saved them about $18,000 when they were going through cancer treatment and had been in the
That's amazing.
hospital. Those reimbursements were just amazing for them. So I always let people know, even in the Medicare Advantage space, as the copays and the coinsurance amounts can keep rising, there is a way that we can supplement that, right? So that, you don't feel like in, again, a major catastrophic event, you're just going to be squeezed at both ends with your bank account. So hospital indemnity and cancer riders are another way that we can help make the experience of having a not so great medical event not be so hard. You can focus on your treatment and not have to focus as much on the bank account.
Yeah, that's a tremendous savings. $18,000. That is, I mean, of course, it's horrible. They had cancer and just going through that, but what a relief to be able to have that much assistance in a crazy time like that.
Yeah. I mean, the coinsurances and the copays on Advantage plans in certain circumstances can really add up. So having that little supplement in place there can really save someone a lot of money. And again, just give them peace of mind during a really hard time.
All right. So now we'll move on to our news section. The big question on a lot of people's minds, of course, is this big, beautiful bill. Can you kind of unfold for us what are people's concerns and what's the actual concerns?
Yeah, we're getting a lot of questions about, hey, what's this legislation going to do? And we're still kind of piecing through it a little bit as well. But it is not like the Inflation Reduction Act, where it really kind of sent some shockwaves through the system with a lot of new Medicare provisions and new out of pocket maxes like the Inflation Reduction Act did. It didn't really focus a whole lot on Medicare. People hear a lot about Medicaid. The work requirements with Medicaid for someone that's 65 or older may impact the type of plan that they're on, because they may have a dual plan that has Medicare and Medicaid as part of it. So there's some specific situations there, maybe some fraud and abuse provisions potentially, but right now we'll just kind of see how it plays out. But right now we don't see a huge direct impact on the Medicare program through what's so-called the big, beautiful bill, like we saw with the Inflation Reduction Act in 2022.
Yeah, I'm hearing they're going to start calling it the OB3 bill, which I thought that was a strange name. I know there'll be some squirrely name for it for sure. All right. Well, this was a great podcast. A lot of great information. Again, any additional resources you need, check out our website at go4oaks.com. Also, feel free to give us a call and ask us any questions at any time. As always, our services are always free, and we're just happy to talk with people and answer questions. One interesting thing that is coming up here in July, Jamin, is it's Insurance Nerd Day on July 18th, which I think is really pretty cool since it's like pretty close to your birthday. So make sure you like and subscribe, and we'll see you guys next time.